Thanks, Miriam. And here we have Dr. Wilson back via video for us. And I can't remember exactly what all Stacy said as she introduced him, but you got to hear him speak about the non-tuberculous mycobacteria. But he is truly my go-to expert whenever I have a MDR or XDR question. I don't know how he keeps all the facts in his brain, and he can just spill them out whenever I need them. So he's a resource that is unequaled, and I'm sure Ruthie's going to have him back up on that screen in a minute, or actually, I guess we get a slide. So thanks, John.
Because I think we're just going to...
Hello. Hello, am I coming through okay? Hello. Am I coming through?
They're waving, yeah.
Oh, great. Okay, thank you very much. I just have to figure out my slides here.
There you go.
And great, okay. Thank you again for the opportunity to talk about more mycobacterial disease with all of you. My wife just texted me that in southeast Minnesota, we're going to have 8 more inches of snow over the next 36 hours. So it's a feel-good moment here in the upper Midwest. So again, I hope all of you are enjoying the conference there in sunny Hawaii. Let's go ahead and start. Drug-resistant tuberculosis, albeit not overly common in the U.S., does occur. It's alive and well and poses many diagnostic and therapeutic challenges that we'll cover over the next half hour. To begin with, let's first define what we mean by drug-resistant tuberculosis. Monoresistance is just that. Resistance to one drug could be any of the first or second line agents, but polyresistant tuberculosis is resistant to one or more, or resistant to more than one of the first line drugs, but not IMH or rifampin together. Indeed, when a tuberculosis isolate is resistant to both isoniazid and rifampin, that by definition is multi-drug resistant tuberculosis. Now, extensively drug-resistant tuberculosis is MDR-TB, again, INH and rifampin resistance, plus resistance to one of the fluoroquinolones, Cipro, levofloxacin, moxifloxacin, one of those, plus one of the injectables like streptomycin or amikacin. When this occurs, if you have a patient with XDR-TB here in Minnesota, you can pretty much be guaranteed on being on the Fox 9 Minneapolis news channel for that evening, giving a report of tuberculosis in Minnesota, and instantly making news throughout the upper Midwest. So it's not a good situation when it happens on multiple levels. As talked about earlier today, roughly there's about 9,100 cases of active TB in the US diagnosed annually.